we get to look at introduction to congenital heart diseases. Look at an introduction to congenital heart diseases. So, for these congenital heart diseases, we just want to have an overview of, what the conditions are, okay, and all of that. So, for this congenital heart disease, you can actually see different types. So, for the introduction, we just want to have a briefing lecture on them, okay. So, they're actually structural abnormalities in the heart. It's something structural. You can see physically there's a defect, So, they are present at birth, okay. So, they occur due to improper development of the heart. That's when the baby was, coming up, the heart was developing improperly. So, typically within the first 8 weeks of gestation. So, they are among the most common types of birth defects, okay. So what are they? They encompass a wide spectrum of conditions ranging from simple defects to defects that are actually life-threatening. Do you understand? So simple defects could actually resolve on their own, while the other ones, you need special treatment and all of that for them to resolve. So the defects can affect the walls of the heart. It could be the valves of the heart. It could be the arteries and veins that carry blood to the heart and also from the heart, okay. So causes and risk factors. Issues could be mixed. It could be genetic issues, could be maternal issues, could be diabetic issues, okay. All right, so classifications. We have cyanotic ones, those ones that is reduced oxygen supply greatly, that's what the skin is becoming bluish. So examples like tetralogy of Fallot, transposition of great arteries. Then we have acyanotic defect. This one, the issue is mild. Do you understand? They do not actually cause cyanosis, but typically they lead to heart failure and other complications. So have examples like Atrial Septal Defect, Ventricular Septal Defect, coarctation of aorta. Okay, so this is just an introduction, and you can pause at this picture. It looks very much more clear to me. And look at the Atrial Septal Defect, where there's what? An opening between the atrials. A Ventricular Septal Defect, where there's an opening between the ventricles. Coarctation of aorta, where there's like a narrowing of the aorta. Then tetralogy of Fallot, where you have about 4 abnormalities. This is just an introduction. Later on, we'll still talk about each aspect. Okay, that's it.